All right, well, Pfizer doesn't know why its vaccines carry the risk of myocarditis. This became painfully apparent in recent hearings in Australia. We're about to show you this video from Senator Gerard Rennick, who had the platform to ask Pfizer these most direct questions. These are the most direct questions we've ever seen anybody ask them in an, official way to their face. The media certainly won't do it. Now, this video is a bit over 3 minutes long, but it's worth watching in its entirety for two reasons. And let's just kind of mark these things. Number one, how they really just do not have an answer and lack of curiosity about the risks of the COVID vaccine and continue to just say, well, we made a calculation, we made a risk benefit calculation, we're going to stick with that. And also how they are just used to being able to dodge this question, with their gobbledygook. Watch.
And can you explain the process why the vaccine causes myocarditis and pericarditis?
I'll take that, Dr. Hewitt. Sure. Based on our clinical trials and pharmacovigilance data, as well as real-world evidence following the distribution now of billions of doses of vaccine, we retain confidence, strong confidence in the safety profile of the vaccine.
Sorry, Chair, point of order. I've asked, do you understand why it causes, I know that it's a low risk, I'm asking, do you understand why it causes myocarditis? I want you to explain to me why it causes myocarditis. Do you understand why it causes myocarditis?
Pfizer is aware of very rare reports of myocarditis and pericarditis that have been temporarily associated with vaccination.
Well, that's still ongoing for some people.
Senator Rennick, Dr. Through should answer the question. Thank you, Dr. Through.
According to public health experts and regulatory authorities around the globe, the number of reports of myocarditis remains small.
I'm not referring to the number of reports. I want you to explain to me the mechanism of how the vaccine causes myocarditis. Do you not understand the mechanism of why the vaccine causes myocarditis? It looks to me like you don't. And if you don't understand it, why are you saying the vaccine is safe without qualifying the risks?
So, Senator Rennick, I think Dr. Thoreau is actually about to get to that point. Whether people agree, whether there's agreement to his evidence or not, is another question for others to make a judgment on. But if Dr. Thoreau, if you could again go to Senator Rennick's question.
Senator, all medicines, all therapeutic products and vaccines have benefits and have side effects as well. Looking at the totality of the evidence for Pfizer's COVID-19 vaccine, regulatory authorities, health authorities, experts globally, including in Australia within the Department of Health and the TGA, have maintained that the benefit-risk ratio...
That's not the question that I asked. I asked, can you explain why the vaccine causes myocarditis? Yes or no?
Senator, the benefit-risk profile...
Yes or no? So you clearly don't understand the pathway, do you? Because you can't explain it. I'm not referring to the cost-benefit analysis here. I'm referring to, do you understand the biochemical pathway as to why the vaccine causes damage to the heart?
Senator, I'm happy to take your question on notice and come back to the committee with whatever information we can provide. I might just clarify, I was not referring to a cost-benefit analysis in my previous response. I was referring to the benefit-risk ratio, and health authorities around the globe continue to recommend the benefits.
This isn't the question that I'm asking. Anyway, thanks, Chair.
But can I just so I'm clarify as well, Dr. Through, you've agreed to take the question on notice and give further response to that question. Is that correct?
That is correct, Chair. As I understand, the question was about the mechanisms, and we're happy to take that question on notice.
Doctor.
Okay.
So we'll get back to you.
Right. So we should absolutely follow up on whether or not they come back with it. I would have liked to have heard, well, we're looking into it, or we have some hypothesis, or we also want to know that, and we may, whatever. They were just kind of like, no, I don't know anything about that, as if it's a brand new question. And now Senator Rennick here acknowledges, sorry.
So I would have loved to have heard him like answer it truthfully and be like, I would rather not tell you. We know, but I would rather not have to say it out loud.
Right.
You know they know.
Well, I mean, and if he's under oath, right, he could have said that, right? He doesn't want to be legally liable for it. He could be like, yeah, I don't want to tell you that because could cause me some harm.
Well, he didn't say he didn't know. Or did he say that? Did he say, I'm unaware and I'll get back to you?
I don't think he said he didn't know. I don't think he said he didn't know.
He said, I'll get back to you.
No, he didn't say... Yeah, he just said, I'll get back to you. He didn't say, I don't know, because they know. He just doesn't want to say.
He's got to know.
It's like that to me, that's what, they know.
P. Soromoto in our Rumble chat says it's genocide and they're getting away with it.
He, at the very least, has an educated hypothesis and can speak to that. If he were to be more candid, they would have some kind of hypothesis. And we're going to get to a hypothesis in a second. Now, Senator Rennick acknowledged that the risk of myocarditis is low, although recent studies would refute that. We showed you this just a few weeks ago from the Department of Cardiology and Cardiovascular Research Institute in Basel, Switzerland. They found that 1 in 5 doses of the Moderna booster resulted in myocarditis. That's not a low risk. But this hearing that we just showed you was about Pfizer. We are going to get to Moderna in a second. But surely there's a similar phenomenon happening if both carry a risk of this one immune response. Shouldn't Big Pharma be super curious? Shouldn't he say, yes, we're working on that, or I'd like to wait until those studies are completed? Or, I can present you with a few hypotheses, and this is what the problem is, if he said, we have these working theories and we're testing them, they'd say, well, are you going to change it? They would say no, because they're not motivated to change it. And I'm going to show you why in a second. Now, here's what fellow YouTuber and Rumbler and health expert John Campbell says is actually the current hypothesis about this myocarditis link.
These lipid nanoparticles carrying the ribonucleic acid are injected into the arm. And we know that the systemic distribution of these lipid nanoparticles, now when the systemic distribution, that means they go all around the body. So these lipid nanoparticles are going to go through the blood vessels in the myocardium, through the coronary arteries, through the coronary capillaries and drained by the coronary venules. It's going to circulate through the heart. Now, these vessels in the heart are lined by a vascular endothelium, living cells. So there's no reason why the lipid nanoparticles won't join up with these cell membranes in the vascular endothelium in the myocardium and the RNA going into those cells. Now, what the RNA does is it hijacks the cells or takes over the cell's protein-producing apparatus. And then the RNA will cause these cells in the vascular endothelium to excrete this foreign synthesized spike protein onto their surface. So you'll now have cells inside the coronary arteries with this foreign spike protein sitting on the surface of it. And as a result of that, there'll be an immune response, an inflammatory immune response. The body's immune cells will come along and say, heck, that's not supposed to be there. Let's make an immune response to it. And sometimes the T cytotoxic cells will say, well, let's destroy that cell, thereby causing inflammation in the heart. Now, I think that mechanism does occur. But of course, you've probably realized already that if the systemic distribution, this will be applying to everywhere, not just the heart. And that is probably true. So why are we so aware of the myocarditis and pericarditis side effects? Well, I think there's 2 factors here. One is that if the heart does stop working, it tends to become fairly obvious within a few seconds. The person would lose consciousness, cardiac arrest situation, if the heart did stop working. The other one is we can measure troponins. These are a readily available, commonly tested for cardiac marker. That allows us to monitor the level of heart damage. So when we see raised troponins, we can correlate that with the myocardial damage because it's a myocardial damage marker. The same could well be happening in a range of other organs. It's just that it's harder to see. The effects could be longer lasting or more deferred, and the markers may be not quite so readily available. So that's one explanation. I'm a bit surprised those guys didn't seem to know about that.
Yeah, you think? I mean, I don't want to minimize John Campbell, but why does a YouTuber have a better explanation than Pfizer at a SED hearing? It should be the other way around, right? He takes this question seriously, whereas Pfizer does not, and came unprepared to discuss this at all. period. Now, watch Senator Rennick ask Moderna representatives if they would reinvest some of their profit that they made from the vaccine to vaccine injury. And what they tell them basically is, well, the government gave us this sweetheart deal. It really should be the government that's working on that. We don't have to. So basically they're saying we don't really have to give you good answers to these questions because we were given full immunity. We were given this job as a government contractor. We don't really have to secure it. And so that's kind of on you. Watch.
So what percentage of profits does Moderna plough back into helping people who are injured by the vaccine?
Thank you. I was going to say we're aware that there is sort of an indemnity for COVID-19 suppliers, but indemnities are a policy matter for government to decide. I can't comment.
So Moderna doesn't put any of its profits back into helping the victims of injuries from the Moderna vaccine. Is that correct?
So Moderna is a company that's focused on manufacturing vaccines. The matter of indemnity for vaccine suppliers is a matter for government.
So you're not prepared to underwrite the risk of your own vaccine. You're not prepared to actually put money where your mouth is when it comes to the safety of your vaccine. Is that correct?
So just before you answer this question, Senator Rennick, I'll have to go to Senator Antic after this answer is given.
That's just the last question there.
Back to you.
Just yes or no, you're not prepared to underwrite the safety of your own vaccine?
We take safety of our vaccines very seriously. We have a very good pharmacovigilance process in place, in fact, a comprehensive one. However, I would only reiterate that indemnities are a matter for policymakers.
But what about a moral, social conscience of putting some of your profits back into helping victims of the vaccine? Zero? Is it $0?
I might just before you, again, Dr. Leong, just before you answer that, I appreciate.
Well, it's just that she's not answering,
no, I respect you asking the questions. I just want to make sure we can get to Senator Antic and keep to our timetable. But
I'll just take that as a zero.
Okay. Now, again, why should they? That was sort of what she's saying is like, well, you gave us this indemnity. You're the one who, like
United
you,
States
the government, right? Any government. She could say that to really any Western government.
Yeah. No.
Basically, like that sounds like a you problem.
Yeah, exactly.
Right. Yeah. We brought forth these things that didn't really work, and you gave us full blanket immunity and indemnity that you would never be able to sue us, or we'd never be in trouble for it. So, frankly, why am I even here answering your questions right now, Senator? I shouldn't even have to answer your questions. Yeah. You literally, you gave us the ability to walk all over us, or we gave you the ability for us to walk all over you. Although there were a couple of countries that said, no, we're not going to give you blanket indemnity. David, what was it? Was it Bolivia? Bolivia. And there are a couple of other countries. There are a couple of African countries that said, no. We're not just going to give you blanket indemnity. And they refused to sell their vaccines to them. Right. Which, I guess good for those people.
Now, why did the government do this? Why does the government continue to be the mouthpiece for Big Pharma? We honestly don't know, and it's becoming increasingly clear that the government just can't back up the things that it asked us to do. We see this in lawsuits in Canada. Now we see this in a lawsuit brought by a watchdog group called the Functional Government Initiative just this week. The suit was brought last year, and in the suit, the group asked for any documents that provided any scientific support relied on by Health Secretary Xavier Becerra when approving or issuing the tweet recommending that all Americans receive a booster shot every 2 months. So that would be 6 COVID shots per year. He said online, if it's been more than 2 months since your last booster, you should get another one. And so they said, okay, this is conflicting information. It seems the government is just ratcheting up the number of shots that they're asking people to take. So how did you come up with that? In response, the government handed over 1,263 pages of documents. None of them, not in one page of those documents, was there any scientific support to say to Americans to get a booster every 2 months. None of it. So he, the Secretary of Health and Human Services, the health secretary, was able to say this on an official platform on Twitter that everyone should get a booster every 2 months with no scientific basis. Here's how that went in court. the official from the Department of Health and Human Services said the department reviewed all of these pages. After careful records, we determined they were not relevant to their request. They couldn't find anything. Now, a spokesperson for the FGI, this group that brought the suit, says the lack of a single record supporting Secretary Becerra's bold public health recommendations for 6 COVID boosters a year is a startling development. It is tremendously irresponsible for the government's chief health official to fire off tweets recommending frequent injections of a new vaccine booster, apparently based on no academic or scientific support. How can the public be assured that the agency is following the science or other important public health matters when it demonstrates such clear disregard for basic scientific integrity? Now, it's interesting because this follow the science, right? Think of, we're going to talk in a second, just how much the government censored people on Twitter for saying things that they said were not based on the science, saying things that were critical of the science, saying things that were critical of the vaccine, saying things that promoted vaccine hesitancy. But this effing guy, right, can just go out and say whatever he wants, and there's no consequence. There's no one there saying this is misinformation. No one marking this tweet saying there's no scientific basis behind getting 6 COVID shots a year. Nothing. There's just this one watchdog group filing a lawsuit, and that's it. So it would seem that lawmakers and drug companies were never following any science. They were just doing what they wanted and then telling us to follow the science, which was whatever they wanted to do. So this becomes increasingly clear. Let us know what you think of this in the chat.
Yeah, these people are killers. These people are killers and they're liars. Daniel Martinez in our chat says they do not want to say the reason why because the mechanism is related to the mRNA delivery method. In all likelihood, they will shift the blame to the spike protein in order to misdirect from the mRNA. Yeah. Interesting point. Thank you for that super chat. Yeah, let us know your thoughts on this in the chat below. They can bring these guys on in front of these Senate hearings, but unless they have like prosecutorial ability, what's going to happen here? Unless they can recommend criminal charges like they're trying to do with Fauci, like Rand Paul is trying to do with Fauci. But these guys are, they're just thinking this blanket immunity.
Yeah, that sucks. So this may be, I see in the chat, people are saying we need Nuremberg trials. This may be as close as we're going to get to it, and it's disparate. So it's a little in the European Union, a little in Australia, very little in the United States. Some lawsuits in Canada. The government doesn't seem to have an appetite there after looking into Justin Trudeau's emergency powers over vaccine mandates and saying that was cool. We may not get exactly that. So we have to, take the crumbs that we're given, pick them up and say, okay, at least we know some of us weren't crazy. That was some bullshit.
Well, and let's not forget the fact that they're still pushing this shit. Right. Yes. As we head into the fall and into flu season, like they're still pushing this stuff.
Right.
So, and they can't answer for it. And and the public health campaign, and of course, mainstream media is totally silent on it. All of those doctors, those pseudo doctors who've been on with the Health Watch segments on CBS and NBC and all these guys that were pushing this stuff. Mm-hmm. Where are their segments now warning people against taking it? I don't see any segments like that.
No.
I don't see any politicians apologizing. I've seen one Canadian politician apologize. There might have been one politician from Denmark that apologized for COVID, for the vaccines.
I believe there was an English politician.
Maybe that's it. That's it on all of this. Unbelievable.
Right.
Anyway, let us know your thoughts on this. Thank you so much for watching this segment here at Redacted. We are live every day at 4 p.m. Eastern time, trying to share the stories that the mainstream media will not cover. You should also come over and join our community of Redacted Rebels over at redacted.inc. That's our private locals community where we can share exclusive content that we simply cannot share here on YouTube. Come over and join the rebellion together right now by going to redacted.inc. We'll see you next time.